Welcome to Landisville Animal Hospital, where we provide an exceptional experience for each client and pet by setting and accepting only superior standards for our actions and procedures. Dedicated to excellence, our highly trained and experienced staff includes doctors of veterinary medicine, certified animal health technicians, veterinary assistants, and receptionists. Our hospital personnel work very hard to be attentive, polite, and caring. Pet owners themselves, our staff understands the concerns you may have when certain procedures are required to improve our pet's health. We invite you to join us on a behind-the-scenes tour with several of our furry friends as we explain the process of a dental cleaning procedure here at Landisville Animal Hospital. Dental health is an important part of every pet's well-being. If your veterinarian detects dental disease, a treatment plan including radiographs and a professional cleaning will be recommended. But why exactly would a pet require a dental cleaning? The risk of a pet getting dental disease, as well as the rate at which it can progress, can be affected by several different factors. Some of these factors include crowding of teeth, which is often a problem observed in smaller breeds, diet, such as dry versus wet food being fed, and an animal's chewing habits. So, it's the day of your pet's teeth cleaning. The morning of the procedure, our friendly receptionist will walk you through your pre-anesthetic consent forms. They will answer any questions you may have, and upon completion, one of our technicians will take your pet to the treatment area. All pets are taken directly to a cage within the treatment area of the hospital. It is here that the pet's day begins with a physical exam from the veterinarian. A complete physical exam is given even if the pet was recently seen. A nose-to-tail assessment is given that morning to ensure there aren't any conditions which would prevent the animal from safely going under anesthesia. While our veterinarians strive to make anesthesia as safe as possible, it is not without risk. Animals with underlying health conditions could be at a greater risk for anesthetic complications. Therefore, basic blood tests are highly recommended prior to any dental health cleaning to check for healthy organ function. These tests help to make certain a pet is healthy enough to be going under anesthesia. Liver and kidney functions and blood cell counts are included in this evaluation. This blood work is run in hospital with the owner's consent. For the most accurate representation, it is beneficial to run this blood work as close as possible to the date of the animal's procedure. Abnormal lab results alert the doctor if anesthesia protocols need adjustment or if it may not be safe to use anesthesia on the pet at all. Once lab results have deemed the pet healthy enough to go under anesthesia, the veterinary technicians on staff place an intravenous catheter. This allows for the delivery of drugs and fluids to the pet during their procedure. Although not all veterinary hospitals do this, we feel this precaution ensures that the procedure is as safe as possible. It allows us to give fluids during the anesthetic procedure to keep the pet's blood pressure up and have quick access to the vein in case of emergency. All catheters are covered with a sour-tasting vet wrap called No Chew to ensure that the animal does not chew the catheter out once it is placed. The doctors and surgery team then calculate the drug dosages needed for surgery, including those that may possibly be needed in an emergency. The procedure begins when the technician first gives a pre-medication to help keep the pet calm and relaxed prior to starting the anesthesia process. This medication is given in the muscle. When anticipating that the animal needs anything painful done, such as teeth extractions, a pain med may also be given at this time. The pet is returned to its cage and given at least 10 minutes for the drugs to take effect. During this time, the surgery team preps the treatment table for the dental cleaning. All pets within their cage are in close proximity to the treatment area, which allows for constant supervision. Our tables are specially designed for this procedure. A grate on top allows the pet to stay warm and dry above any draining fluids. In preparing for a cleaning, a towel is draped over a heating pad. This rests on a soft pad that we've made to provide cushion for the animal. All monitoring leads are unwrapped and towels are positioned for the animal's head. When a pet's cleaning is about to begin, an anesthetic drug will be injected through the catheter, causing them to fall asleep quickly. Next, an endotracheal tube is placed through the mouth into the trachea. This tube provides direct access to the lungs for the flow of oxygen and gas anesthesia. Once in the airway, a small cuff is blown up that forms a seal within the trachea. This cuff protects the lungs from fluid and bacteria and allows for the best delivery of oxygen and anesthetic gas to the lungs. Once under anesthesia, the surgery team hooks up all monitoring leads. A probe on the ear monitors oxygen and heart rate, leads are clipped for the EKG, a blood pressure cuff is placed, and fluids are given through the catheter. The technician lubricates the animal's eyes to prevent ulcers, gives an antibiotic injection, and a complementary nail trim. Teeth cleaning procedures can often be a more complicated procedure, so it's important to safely maintain an adequate plane of anesthesia for the animal. In addition to having top-of-the-line monitoring equipment, we are proud to say that we have a technician on staff for every anesthetic procedure to provide hands-on anesthetic monitoring. Vital signs are closely monitored during the procedure to be sure that the pet is not awake or feeling the procedure, but also to be sure that there aren't any complications. Heart rate, carbon dioxide levels, oxygen levels, and blood pressure are recorded by the computer, and all information is graphed on a chart which is printed at the end of the procedure and kept in the animal's records. Temperature readings are also taken and recorded every 10 minutes by the technician. While under anesthesia, the body is unable to effectively regulate temperature, so measures are taken to safely keep the animal warm. A blanket is placed over a convection warmer which fills with hot air. We also keep a heating pad under the animal for the entire procedure. Reusable heat packs are also placed alongside the animal if needed. The surgery technician changes into her dental cleaning personal protective equipment, including goggles, gloves, a mask, and gown. She takes a digital photograph of each side of the pet's mouth to be charted within the animal's record. Before any cleaning is done, another oral examination under general anesthesia is completed. The technician and veterinarian examine all aspects of the mouth, including all of the teeth and gums, the tongue, cheeks, and roof of the mouth. The technician first begins the cleaning process by manually removing large chunks of excess tartar. Next, the dental plaque and tartar is removed using an ultrasonic scaler and hand tools. A vibrating ultrasonic scaler creates heat, so water is constantly sprayed to keep the instrument cool while rinsing away any of the calculi that is cleaned off. Due to the heat created, the scaler is used on crowns and exposed root surfaces only, and she doesn't stay on any given tooth more than 10 seconds. The technician moves the scaler from the gingival margin down to the tooth tip, making sure to use overlapping strokes so she doesn't miss any surface area. The tip is kept parallel to the tooth surface, and the head of the animal is positioned so the water drains away from the animal's mouth. A hand scaling instrument called a curette is then used under the gum line for any tartar removal. It has a blunt, curved edge which makes it less damaging to the gums. Regardless of how careful we are during the scaling and curette phase of teeth cleaning, minor defects of the tooth surface occur, so the technician then polishes the teeth. Polishing smooths the tooth surface so there are no etches after cleaning, and it slows the formation of calculus in the future. If any fine grooves are left, it only allows for more surface area for plaque to adhere onto in the future. The technician polishes the teeth using a polishing head and a prophy paste. The spin of the head allows for the even spread of the polish. After polishing is complete, the mouth is rinsed of all polish, and the technician uses a periodontal probe to look for signs of periodontal disease and any other abnormalities. She gently places the probe tip along the gingival margin to see if the probe sinks in anywhere, identifying a periodontal pocket. These pockets are areas along the teeth where supporting tissue and bone are destroyed, forming a pocket around the tooth where bacteria can grow. The technician records her findings on a laminated dental chart. This allows her to move quickly so the patient isn't under anesthesia longer than needed. She observes and records any missing, loose, fractured, or discolored teeth. She also records any enamel defects, root exposures, oral masses, the grade of gingivitis, grade of calculus, and any exposed pulp, or the area within the tooth which contains sensitive nerves and blood vessels. During her assessment, if any periodontal disease is found, dental radiographs may be required to assess the extent of damage. Dental radiographs, or X-rays, are taken by the surgery technician wearing the proper personal protective equipment, including a lead apron and thyroid shield. These X-rays are taken with a plate much like one that would be used by a dental hygienist. The veterinarian will review the radiographs, which allow her to assess the health of the tooth roots and not just the visible portion of the mouth. She is then better prepared to determine where dental extractions are required. Upon finishing her assessment, the doctor and technician review the radiographs along with the pathology of the mouth charted and begin the extraction process. Dental extractions can be fairly simple, however, they can also be very difficult. While some teeth can be extracted with a simple pull, others require more extensive work using drills and elevators by the doctor. Radiographs are taken post-extraction to ensure that there are no tooth remnants left within the tooth socket. Once all extractions are complete, the veterinarian sutures the surgical extraction sites with the assistance of the technician. Fluoride foam that helps strengthen and protect tooth enamel is then sprayed onto the pet's remaining teeth. This is allowed to sit for 3 minutes before being sprayed off by air. Once the teeth are completely dry, the technician applies a wax-like material called Oravet gel. This product significantly reduces plaque and tartar formation by preventing bacteria from attaching to pet's teeth. Once the procedure is complete, the animal is unhooked from the gas anesthesia and closely monitored by the surgical technicians through the recovery process. Once awake and at a safe temperature, the doctor or dental technician calls the owner to give a status update and inform them of the details of that day's procedure. All recovering pets are offered a snack, taken for a walk, and catheters are removed. During the pet's recovery period, the dental technician records the oral findings and treatment rendered that day within the patient's chart. She transfers all information from the laminated chart onto a permanent full-page dental chart. These charts provide accurate documentation of the pet's dental pathology that can be referred to over the pet's life. Changes in dental health can easily be tracked by referring to earlier charts of the same patient. This allows the veterinarian to follow a patient's progress through the years. Before and after pictures from the day's procedure are also placed within the chart. The technician prepares a discharge packet for the owner. Informational brochures are provided to support at-home dental care, and a diagram is filled out to represent the dental work that was completed that day. Discharge instructions are typed to go home with the owner so they know what to expect for post-op care, and if any extractions were done, pain medications are dispensed. So your pet's dental procedure is complete and you've come to take them home. At this time, one of our knowledgeable technicians will happily go over the discharge instructions provided by the surgery team. We will explain the radiographs taken, expectations for recovery, and how to maintain good oral health at home. Now you know what happens behind the scenes the day of your pet's procedure. We are so happy to have you as part of our family, and we hope you go home satisfied with your visit. Our dental cleanings encompass a lot of procedures. Measures are taken to ensure your pet receives the safest and highest quality of care. However, dental care does not end there. Within 24 hours, plaque has already started to form on the teeth and the periodontal disease process starts all over. This is where home care comes in. Please understand that you as the pet owner are an integral part of our dental team. Home care is the single most important procedure to maintain oral health. We offer many products and services to maintain great oral health at home, including brushes, toothpaste, oral rinses, dental-specific prescription foods, dental chews, and Oravet gel. We want you to go home confident that your pet is healthy and happy. We believe that your pet is special and deserves to be cared for with love and respect. We provide an exceptional experience for each client and pet by setting and accepting only superior standards for our actions and procedures. Thank you for joining us on our behind-the-scenes tour, and we hope to see you again soon.